It's about 10 o'clock right now. We were scheduled to start at 10, but just kind of looking at the participant count that we have thus far and knowing what we typically have each week, we're going to wait a couple minutes to get started until more folks have joined. Good morning, and thank you for joining us for this webinar on COVID-19 guidance for early learning and care contractors. This webinar is being presented by the California Department of Education's Early Learning and Care and Fiscal and Administrative Services divisions. This webinar is being held on September 4th, 2020, and is scheduled to run from 10 a.m. until 11 a.m. We want to thank you for taking some time to join us for this webinar. My name is Stephen Profiter, and I'm the Director of the Early Learning and Care Division at the California Department of Education. At this point, we're just about 6 months on the nose, if I recall, since the governor declared a state of emergency due to the COVID-19 pandemic. We've seen a series of policy changes in response to the pandemic that have turned many aspects of our world on its ear. I'd like to acknowledge here that we know many of you have been anxious for guidance. We see it every week in these webinars, and we hear from you by phone or email in between. We also know that many of you are not exactly pleased with some of the guidance we've released, whether it is how LEAs and community-based organizations are handled regarding the hold harmless provisions in the budget, or what supports are available for issues around parents, providers, or staff needing to quarantine. We do not relish the position we're in and are working to implement the Budget Act in the most humane way possible. But I also want to acknowledge we are also in a position where we don't necessarily have an option to not implement what the legislature and the governor have enacted. I also want to acknowledge, excuse me, that this week we learned of 2 more incidents, both this week and then one that actually happened a few months ago, of the use of deadly force. While we're sure more information will come out, too often we see the use of deadly and excessive force applied to people of color. It's sadly another stark reminder of the collective work we have in front of us. We're also currently in a space where we're still dealing with fires, poor air quality, and everything that comes with it in many parts of the state. At last check, the 2 largest fires in the state, and so something on a more positive note here, the fires in the state were at over 80% containment, which is a testament to the hard work those fighting the fires are putting in, especially when you think about how many different fire events are happening. These fires are also a testament to the fact that climate change is real, and while we all have our part, we all appreciate our collective work to reduce the impact and combat the effects of it. It definitely impacts our reality in terms of fires and other things, and for a profession that supports the prospects of our youth, we know our children will inherit the earth we leave, and we want the best for our children. As with our previous webinars, we continue to accumulate questions and concerns from many of you through the emergency email address, through stakeholder group meetings, contacts with ELCD staff members and Fiscal and Administrative Services Division staff members, and questions and answers from each week's webinar. We are committed to being as responsive as possible, and the panelists that are on this webinar are actively monitoring the questions coming in through the Q&A feature. While we try to address as many questions as possible, we won't be able to get to all, but we will do our absolute best. And speaking of doing our absolute best, I want to stop here and thank the team that work each week to not just ensure we're prepped and we have answers and content ready for these webinars, but are also working to prepare guidance to implement the budget at the same time. It is in no way an easy job, and I'm honored to have the opportunity to work with this team. Before I close my part, I wanted to provide a preview to a webinar we're planning once this iteration of the budget is signed. We're currently working with the Department of Social Services on a joint webinar to provide guidance specific to issues around voucher-based programs. So please look forward to an announcement or more information on that through the ELCDs or for folks that have signed up to receive emails through the Early Learning and Care Division's distribution list. And with that, I will turn it over to the Early Learning and Care Division's Associate Director, Erica Otiono, for some additional remarks.
Good morning, everyone. I just want to say happy Friday and thank you for joining us today. We have lots of information for you. So looking forward to all the updates and what's coming up that you will hear. Thank you.
And so thanks, everybody. My name is Virginia Early. I'm the Policy Office Administrator here at the Early Learning and Care Division. Many of you have seen me on previous webinars, and today I will be co-leading our sort of CDE guidance, what's new and what's going on, with my colleague Guadalupe Romo Zendejas from our Program Quality Implementation Office.
Thank you, Virginia. Happy Friday, everyone. Can we move on to the slide?
Alana needs to do some housekeeping first, real quick.
Sorry.
That's okay. So my name is Alana Andrade, and again, I'll be the webinar moderator today. I am a child development consultant in the Policy Office. And here to answer some questions today from our Program Quality Implementation Office, we have Cassandra Lewis, Richard Miller, Yer Zong, Christina Toney, Mai Zong, and from CDNFS, we have Andrea Johnson and Alan Lynch. As we begin, we ask that you continue to mute your microphone. And as Stephen said earlier, Our team is committed to being as responsive as possible, and we will try to address as many questions as we can. And we won't be able to get to them all, but we will do our absolute best. If other questions arise that aren't answered, please submit them to ELCD's emergency inbox at elcdemergency@cde.ca.gov. And just to note that we at ELCD will be releasing emails and e-blasts and frequently asked questions and management bulletins to the field just as soon as we are able to. And at any time during the webinar, you can write in and send your questions using the Q&A feature, as many of you have already been doing. And we will also save answering some questions live until the end of the presentation. If we are unable to answer some of the questions that we've received, all of those questions are still being captured. Another thing to note as we go through the presentation, that all of the children in the photos are from our programs. The ones that you're seeing right now are from Cadango. And now I'd like to ask Stephen back so he can talk us through the agenda.
Great, thanks, Alana. So by way of an introduction to our work and an overview of what we're working on, our staff have been working to implement the legislation that's been enacted or recently passed by the legislature and governor. As part of our work prior to either iteration of the budget being passed, we provided some technical assistance and elevated issues you all had raised to us. Since this webinar series began, the revised August budget trailer bill went into print and the legislature passed it just this past Monday, August 31st. It feels like it's been longer, but that's kind of a testament to the COVID time warp that we're all feeling. We're still waiting for the governor to sign it. So the governor has until the end of September, technically, to sign the budget trailer bill, which is also known as Senate Bill 820. We are hopeful he signs it earlier and are working to make sure we have guidance ready to go out to implement the budget once he does sign it. So today we want to provide you with a status update on ongoing CDE guidance work, both in terms of what's new and what's ahead, so you know where everything is. We will also be covering fiscal updates. And then finally at the end, we will take questions as we have in previous webinars. We'll start with some questions that have come into our ELCD emergency email box. As Alana mentioned, we won't be able to get through everything but we will do our best to address as much as we can. You may also use, as Alana mentioned, the Q&A function in Zoom to put your questions in. We're going to do our best, as we've done with previous webinars, to address as many questions as possible during this webinar before we get to the kind of the space at the end where we'll also address questions. But just, rest assured, whichever questions we don't get to, we're going to take back to work into address FAQs on our website. And at this point, I will turn it over to Lupe now to discuss the ongoing CDE guidance work.
Thank you, Stephen. Happy Friday, everyone, again. I was excited there for a minute. Let's go over the reopening for direct contract programs. Direct contract programs include general child care, CCTR, California State Preschool, CSPP, Migrant Center-Based, CMIG, Family Child Care Home Education Networks, CFCC, Severely Handicapped Programs, CHAN, and Family Child Care Home Education Networks operated under any of these program types. Direct contract programs that are being funded to be operational for fiscal year 2021 must reopen in accordance with Senate Bill 98 or pursuant to the directives provided in the listserv email released on July 19th, 2020. As follows. Programs must be physically open by September 8th or within 21 calendar days from the start of their approved 2021 program calendar, unless they are operating on an LEA, local education agency, campus that determines it cannot be open. These programs may remain closed until the LEA determines it is safe to reopen. Senate Bill 820, which is awaiting the governor's signature, will provide additional clarity for agents who operate on a LEA campus. In order to be funded to be operational, the LEA authority that required the early learning care program closure is required to hold a public hearing to address the closure and prepare a plan for reopening as soon as safely possible. The early learning care programs must not remain closed if or when the LEA campus opens for in-person TK instruction. Let's go over some frequently asked questions that we have received. First one, if I reopen as required, but close because of a public health order later in the fiscal year, will I still be funded to be operational? The answer is yes. Programs that open in accordance with the requirements and subsequently are required to close due to a public health order may still be funded to be operational during fiscal year 2021. The public health order, second question. The public health order issued by county health department requires modifications to the facility in order to meet the requirements to safely serve children and contain the spread of COVID-19. It will take some time to make the modification. Will I be funded to be operational for the time it takes to make modifications to meet the public health order? Answer. An agency may close and be funded to be operational for a reasonable time under all the circumstances it takes to make the modifications required to be compliant with the public health order. Question number 3. My program operates on an LEA campus that is closed and the LEA will not allow me to reopen. Can I be funded to be operational? Answer, yes. However, the LEA authority must convene a public hearing to address the closure and prepare a plan for reopening as soon as safely possible. The early learning and care programs must not remain closed when the LEA campus opens for in-person K-12 instruction. Additional guidance will be provided in the forthcoming management bulletin. Agencies that choose not to reopen within the time frame specified in the Education Code or who choose to close without a public health order may submit a revised program calendar and program narrative change to adjust their maximum reimbursable amount and allow reimbursement for the period of time that they are open. For example, a university campus that chooses to only provide distance learning for the fall semester without a public health order may submit a revised program calendar and program narrative change requesting to operate only during the spring semester. The CDE will adjust their MRA to reflect the revised days of operation. For example, if the program calendar included 250 days of operation and they reduced the days of operation to 125, the MRA would be adjusted by 50%. A public health order may include a written directive, guidance, or recommendation issued by a state or public health official. The operative word is written. Verbal recommendations will not be accepted. To be considered open, a contractor, to the extent possible, must provide in-person services to all enrolled families. For examples, some examples include programs operating multiple sites may have one or more sites closed due to a public health order will be considered open as long as they are providing distance learning activities to enrolled children. Programs that open, however, cannot serve all enrolled children due to capacity issues that arise due to group size limitations included in guidance issued by a state or local health official. Programs that are open, however, due to need to consolidate sites because of low attendance, families choosing to shelter in place, may continue to be reimbursed as long as they provide distance learning services to families. If all sites or classrooms are only providing distance learning, this does not qualify as being physically open. Budget Trailer Bill, Senate Bill 820, recently approved by the legislature will include additional guidance regarding reopening and reimbursement. A management bulletin providing additional guidance will be issued upon the governor's signature on the budget trailer bill. In addition to the guidance provided previously, the management bulletin will include guidance regarding public hearing and reopening plans for LEAs that close K-12 or TK to 12 campuses, and also require early learning care programs operating on those campuses to remain closed. Guidance for prioritizing services to families when a public health order limits capacity of the program that prevents the agency from serving all enrolled children. I'm going to turn it over to Corey to talk about some fiscal issues.
Okay, hi everyone. Thank you, Lupe. So now that Lupe has gone over the criteria of reopening, I'm going to talk and walk through with you all how this affects your reimbursement in fiscal year 2021. So specifically, this information applies to the following contract types. So it is California State Preschool, CSPP, the General Child Care Program, which is CCTR, California Migrant Child Care, CMIG, Children with Severe Disabilities, which is CHAN, and Family Child Care Home Education Networks, or CFCC. So all of this applies to those 5 contract types. So contractors that reopen per the criteria specified in SB 98 and the Education Code will be reimbursed based on the lesser of your contract maximum reimbursable amount, also referred to as your MRA, or your program's net reimbursable cost. So with that, enrollment and attendance will not be taken into consideration when determining your contract payments. So as stated in previous webinars, contractors are required to continue to report the enrollment and attendance data on our Child Development and Nutrition Fiscal Services, CDNFS fiscal and attendance reports. And actually on last week's webinar, Andrea Johnson had walked participants through how to report the days of attendance on the CDNFS fiscal and attendance report. So the next slide includes a matrix of how contractors will be instructed to report the days of operation and days of enrollment on the CDNFS report form. So now I will discuss how to report the days of operation and days of enrollment in fiscal year 2021. So reporting these in these 2 categories will be dependent on the criteria that Lupe kind of discussed earlier. The email to subscribers on the distribution list that was dated July 19th allowed both LEAs and non-LEA direct contract programs to remain closed through September 7th as you are awaiting guidance from the CDE and working through how to best reopen safely. So therefore, for purposes of reporting between July 1st and September 7th, which you see in this the middle column here of the slide, contractors will report the days of operation originally planned for the agency, regardless of whether the program was open to provide in-person care to children. So contractors will also report the days of enrollment associated with the days of operation originally planned for that agency, regardless, again, of whether you were actually open to provide in-person care to children. So then there was a subsequent email that was emailed to subscribers of the distribution list that was dated August 21st. And it stated that contractors that do not reopen by September 8th without a written local or state public health order or guidance will not be reimbursed for any time period that the program was not physically open. So therefore, for purposes of reporting between September 8th and June 30th, which you see on the slide, the matrix, it's the far right column, Contractors will report the days of operation and days of enrollment that the program was either physically open to provide care, or the days of the program that was not physically open, but that was specifically due to the written state or local public health order or guidance. So again, if you were closed due to a written local, state, public health order or guidance, you may report the days of operation and days of enrollment as if you were providing care. So alternatively though, if you are closed without a written local, state, public health order or guidance, the contract MRA will be prorated if A or B are not met, and contractors will not report the days of operation or enrollment during this time. So that's if you just close for other reasons. I do know that this is a lot of information and it could be overwhelming. I do want to let you know that we are incorporating all of this information into the forthcoming management bulletin. I think the main takeaway from all of this information though is that if you're closed and not meeting the criteria per education code and SB 98, your contract will be prorated and you will not report the days of operation or enrollment during that time or during that period of closure. So that was all I had for the fiscal updates for this week's webinar. So I'm going to turn it back over to Lupe.
Thank you, Corey. Now let's move on to distance learning requirements. In accordance with the provisions of Senate Bill 820, specifically Education Code 8209 F3, programs that are closed but funded to be operational must provide distance learning services as specified by the SSP, by the State Superintendent of Public Instruction. Distance learning services must be offered to any family that is not receiving in-person services, including when a site is closed or when a family chooses to shelter in place. Distance learning services must meet the program quality requirements outlined in California Code of Regulations Title V. They must be developmentally, linguistically, and culturally appropriate for children being served. These requirements will not mirror transitional kindergarten or kindergarten requirements, and there are no minimum instructional minutes that need to be met. Agencies who are not providing in-person early learning services to enrolled school-age children receiving TK through 12 distance learning services and not attending school in person will not be required to duplicate efforts. Contractors are required to submit a distance learning plan describing how distance learning services that meet the requirements set forth by the SSPI will be provided. The requirements must align to existing program quality requirements found in California Code of Regulations, Title V. A management bulletin providing additional guidance is forthcoming. The Early Learning Care Division is working diligently to get this management bulletin released within the next week. So on top of the COVID, next slide, please. On top of the COVID-19 pandemic, many areas in the state are being impacted by fires. We want to assure you that funding will continue to be available to agencies that are impacted by these fires. The Early Learning and Care Division is currently working on guidance for non-COVID-19 related emergency closures. Because of the new reimbursement requirements imposed by Senate Bill 98, specifically Education 8209, ELCD is updating guidance regarding non-COVID-19 emergency closure requests for the fiscal year 2021. The ELCD is working to ensure that the process is simplified and streamlined. We expect to have a management bulletin out within the next week or two. Education Code Section 8271 provides against loss of funds due to circumstances that are beyond the control of the contractor. It states that in the event event that operating agencies are unable to operate due to incomplete renovations authorized by the state agencies or due to circumstances beyond the control of the operating agency, including earthquakes, floods, or fires, such programs shall not be penalized for incurred program expenses, nor in subsequent annual budget allocations. Contractors who have had to close for unforeseen circumstances will be able to claim a non-COVID-19 emergency closure and fully earn their fiscal year 2021 contract. Circumstances beyond the control of operating contractors include, but are not necessarily limited to, natural disasters such as earthquakes, floods, or fires, impassable roads, and incomplete facility renovations. That concludes the guidance update. Now on to Erica for program quality implementation updates.
Thank you, Lope. So we're shifting gear a little bit. The Program Quality Implementation Office, as you know, we are responsible for providing training and technical assistance to the field. So for today's presentation, we decided to just focus on two key elements. On the slide, you will see it has just two elements: the desired result developmental profiles, which applies to direct service contractors. And also we have, on that slide, we have staff and provider support, which applies to all programs. So I will just start by saying that, as we all know, the DRDP provides a framework, a valuable framework for observing children's development and reflecting on it, and for monitoring children's social emotional development. And during this pandemic, a potentially traumatic time, we have to watch for learning loss as we support children and families. In light of the difficulties that programs and teachers are facing because of the pandemic, ELCD will propose, and I will repeat, propose a flexible framework for completing the DRDP within 60 to 90 days from the time of enrollment, and will allow the utilization of a modified version of the DRDP Essential View, which consists of fewer measures. Specifically, the DRDP Essential Modified View consists of 3 domains with 16 measures as against 25 for preschoolers and 13 measures for infants. 16 for preschoolers and 13 for infants. As always, teachers and providers are encouraged to work closely with families to support children's development. During this difficult time, children's learning and development may look different. The DRDP will provide teachers, providers with information they need to refine their practices, both in person and in virtual settings, to the best to meet the evolving needs of children they serve. Please note that this is only a proposal at this time. We will also be working with our special ed division, who have just put out their DRDP guidance to the field, and we will work with you as stakeholders. Again, this is just a proposal. Now, let me say a few words about the second bullet on the PowerPoint. Let me say a few words about staff development and provider development. As we encourage the development of children, so we must continually look to the development of staff and our providers. I want just one recommendation that we want to make. The California Early Childhood Online has many resources. Known as iscal, it has 8 modules on health and safety, each 1.5 hours in length. Additionally, the Office of Head Start and the Department of Social Services website, they have many health and safety resources and training available. Please use these resources as you see fit And before I conclude, I just want to say, please do not forget to take care of yourselves. Thank you. I am going to pass it over to Virginia to discuss the family fees language in Senate Bill 820.
All right, thanks, Erica. So family fees, we know this is a hot topic. We've gotten a lot of questions from people. We keep hoping that we will be able to release guidance in an email really shortly, but we wanted to go over with you just in a more detailed level what the language in Senate Bill 820 says. As a reminder, we're still waiting for Senate Bill 820 to be signed by the governor. Stephen mentioned earlier that the governor has until September 30th to sign. And we're working through sort of what we can issue in advance of that in terms of guidance. But we do want to refer you to the language in Senate Bill 820 around family fees. It's section 60, paragraph D1, and then capital D. So we've put the language on the slide, and I'm just going to walk folks through it. There's some pieces where you'll see ... just to fit it on the slide. We kind of cut some places. But basically, family fee waivers are extended through August 31st. That's the July and August fee waivers that we've already discussed. There's language that says that family fees that are collected for July and August shall be refunded to the family or credited to a future month. There's language that says that if there were those families who are disenrolled either voluntarily or involuntary due to family fees in July or August 2020, that they can be re-enrolled without the need for any additional eligibility documentation. The big the paragraphs that are sort of creating the most complexity for CVE in terms of issuing guidance are paragraphs 4 and 5 here. So paragraph 4 says that from September 1st, 2020 through June 30th, 2021, family fees applicable for programs administered by the State Department of Education, CDE, are waived only for families that are described in section 8273.1 of the Education Code. So those are the families that already didn't have to pay fees because they were in Part Day State Preschool, or they were receiving Child Protective Services, or whatever. Those families that are described in our Management Bulletin 2013 as not having to pay a fee. So all the families that normally don't pay fees don't continue to not have to pay fees, and families where all children in the family are enrolled in who are enrolled in subsidized early learning and care remain at home, either for distance learning or for family sheltering in place. So this one has been a bit complicated for us because programs don't necessarily know in advance of how, what families might be doing. Fees are paid in advance of services, distance learning and family sheltering in place. That's not necessarily something that's known about in advance. So if you have concrete suggestions for us of how we can implement it, please feel free to put that in a Q&A. Obviously make it clear that it's a suggestion and not a question. And we'll take that back as we've had to navigate this very thorny issue here. The other piece that we just wanted to make sure that folks saw the language from Senate Bill 820 is paragraph 5, which says that to the extent that additional federal funds are not provided, the cost of waiving the fees for paragraph 4, pursuant to clause 4, shall be absorbed by either the respective direct services contractors, family child care home providers who are participating in a family child care home education network, or a FECHN, and alternative payment program providers. So basically, if federal funds do not come in, then we'll have the providers will be required by this bill to absorb the cost of the distance learning and sheltering in place fee waivers from September through June. So we just wanted to sort of put this language on the screen with you, let you look at it, let you mull over it, and then also allow you the opportunity, you know, if there's specific recommendations you have about like specific ways that we can make what is a very challenging law workable for the field, please do put those in the Q&A and just mark them as suggestions so that the team answering questions behind the scenes knows not to answer, that it's a suggestion. So very, very complicated. We're working tirelessly. I think we've looked at 3 different ways this could potentially work, and we're still thinking through everything. I think, like Stephen mentioned, we're in the tough spot at CDE of having to implement the law, and sometimes the law is challenging to implement because it creates administrative burden. So we want to make sure that that we're getting your feedback there. So at this point, I think we'll turn it over to Alana for questions, so we can address questions that are coming into our chat box. But just thank you to everyone for being here today and for your patience as we've had to navigate some challenging timing issues with the fact that Senate Bill 820 is not yet passed, and some challenging implementation issues on just some of the complicating factors that come with implementing this bill.
Excellent. Thank you, Virginia. So first, I see a lot in the Q&A box about, will there be the slides posted? Will there be a recording posted? And yes, we are working with our Technology Service Division. And also there's been some really wonderful suggestions about just getting the Q&A box itself somehow posted fully. And that is something that we're going to be working with our Technology Service Division in order to get you access to that as quickly as possible. So thank you for that suggestion. Now for some of the first questions, there's still been a lot on of how to submit plans to CDE once, let's say that they've gone through an LEA. Yes, so I'm going to ask Lupe to answer that one.
Thank you, Alana. The plans will have a due date, and that will be provided in the management bulletin. Distance learning has been a requirement from July 1st. So the only thing new is that we're setting the plan requirements and what you're supposed to cover. So that is the new part, and we will have a due date on that.
Excellent, thank you.
To clarify, Lupe, you're talking about the distance learning plan when you say the due date?
I don't have one off the top of my head. It depends on when the management bulletin goes out.
I just wanted to clarify that you were talking about the distance learning plan and not the reopening plan.
Correct.
Okay, thank you. And there are some questions here about enrollment. So Corey, I have a question for you. If the agency is unable to enroll enough children to meet the contract this year, will the CDE reduce the contract for the following year?
So I think the question is specifically asking about contractors know that we have this process called contract review, where we review agencies' contract and how they're earning their contract historically. So we currently have not developed the criteria for this year's contract review process, which ultimately affects next fiscal year. But again, this fiscal year's earnings and reimbursement does not take into account enrollment level. So you are still required to report the enrollment, but we will not use it for purposes of determining your contract earnings for this fiscal year. So as we do every year, we typically for the contract review process, we take into consideration like the current climate affecting our contractors, any laws that have been passed around reimbursement, which would be what we have been discussing. How it's based this year off the lesser of contract MRA or net reimbursable costs. But other than that, we just haven't developed that criteria yet, but I can say that reimbursement and earnings do not take into consideration enrollment level.
Okay, thank you, Corey. There are also some questions about if their school board meeting and public hearings have already happened. Stephen, can I ask you to speak a little bit about that, please?
Yeah, thanks. So yeah, we've got some questions about whether about if the LEA has already had a hearing about closing sites and then reopening them. That they've essentially satisfied that requirement if, say, as long as they've included, say, if the LEA has community-based organizations that also operate on the LEA campus, as long as they've included kind of, you know, them in the hearing as well, because they're certainly impacted by the LEA's closure, then that would be, you know, considered satisfied. And we are working on guidance in the management bulletin, not to provide the plan to CDE, but rather to submit some kind of a verification, some kind of a certification that the hearing has been held.
Thank you. So Lupe, I have a couple of questions for you regarding the information that you shared in your slide for reopening for direct service contract programs. So one of them would be programs that are reopened in accordance with the requirements. Oh, I'm sorry. If they're reopened as required, but closed because of a public health order, will I still be funded to be operational?
Yes. If you reopened and the public health order comes, say you reopened on July 1st, you got a public health order on August 30th, and you had to close, then yes, you will meet the requirement. You will have met the requirements and will be reimbursed.
Excellent. And don't go away, Lupe. I still have more questions for you.
I'm not going away.
Alana,
Yes,
can I add to that as well? So, because
Sure.
I do see some questions in the Q&A about like concerns about meeting the MDO, so the minimum days of operation in their contract. So just to piggyback on what Lupe had mentioned, if you're closed due to a public local health or state order or guidance, you will, as I showed in the table, you will report those days of operation as if you were open. So anytime it's due to that written local or state public health order or guidance, you can still report them on our report form. So therefore you will be meeting the minimum days of operation or working towards meeting the minimum days of operation.
Okay, thank you, Corey. Okay, let's see another question that's come in. Okay, so Lupe, so a public health order was issued by a county health department and it required modifications to a facility, and it will take some time to meet the modification. Will I be funded to be operational in time, even if it doesn't meet the September 8th deadline?
That is correct. So if you have to make modifications and circumstances prevent you from making them by the September 8th date, then yes, you will be funded.
Okay.
I want to just add in one thing. If for some reason you're not meeting any of those different options that Lupe mentioned on her slides to be either open by September 8th or closed for a specified reason, just please note that you know, it's not that you don't get paid, it's just that you get paid in a different way. So you're not sort of paid at the sort of, you know, the way that Corey described. I don't know, Corey, if you want to add anything more to that.
So, I mean, I think I mentioned too on one of my slides that if you don't have a written local or state public health order or guidance in place, we will require that you submit a revised program calendar, and that gets adjusted. So your MDO in that case would be adjusted downward, and also we will be prorating your MRA down. So anytime it's not due to, you know, that guidance, that written guidance that has been released, then that's where, and it's after September 8th, that's where it could affect what you can earn that in this fiscal year. Again, like Virginia said, you'll still be reimbursed, but it could be the lesser of, when you look at the lesser of your costs or MRA, it could be that lower prorated MRA that is limiting your reimbursement.
Thank you, Corey. This is Erica Otieno. I just want to add that please, if you're not able to meet the deadline, to reach out to your regional consultant. Just keep the communication and the connection.
Excellent, thank you. There are a lot of questions coming in about the DRDP and the use of the Essential DRDP tool. And specifically about timing. When will this be released?
We are currently, again, this is Erica Otieno. We're working on the listserv to go out to the field. We have a meeting next week. And thereafter, we will, of course, talk to stakeholders before we finalize it. We're not doing anything retroactively, so just note that. So, coming soon. The listserv will be coming soon.
Thank you, Erica. There are also a lot of questions coming in about how to follow group size and which group size guidance to follow, specifically since the California Department of Public Health released something. So let's see. Well, maybe I can answer it. How's that? So, well, contractors could just follow the guidance that's stricted in there, or your local public health authority, whichever is more stringent or smaller. And let's see, there's more questions regarding a reopening. And so, Virginia, can you speak to where they should send their reopening plan to, or how that's going to look?
Yeah. So, so for the reopening plan, the plan itself doesn't need to be sent to CDE. We will be providing the field with a template that the governing authority of the LEA will sign off on that there is a plan, and then that form will need to go to the program quality implementation regional consultant. So more to come on that.
Thank you, Virginia. And I've also seen a few questions that were specific to our CDMIS team, our Child Development Information Management System team. They were unfortunately not able to be with us on this Q&A, and so just rest assured that we will take those questions and we will bring it to them so that they can get answered. Okay. So while we're still getting in a few more questions, let's see. Other folks are still asking about when the guidance will be released. As our panelists have said earlier, once the Senate Bill 820 has been signed, then the guidance will be released shortly after. Okay.
I'll clarify here that there is one piece of guidance we're working on, which is the distance learning management bulletin, which is not dependent on SB 820. And so we anticipate that will come out before, assuming Senate Bill 820 is not signed on Monday or Tuesday, we anticipate it will be out before, it'll be out hopefully sometime next week.
Okay, let's see more questions that have not been answered. Thank you so much for your participation in our Q&A box. And thank you also for sharing a lot of the suggestions. And we also appreciate every thank you as well. We do work long hours and we do this for you, so appreciate that. So I'm going to ask Barbara to move the slide deck over to our resources. So while you're still continuing to get your questions in, some of the resources that we've listed in. So the slides for this webinar, along with any of our management bulletins and FAQs, can be found on our ELCD COVID-19 guidance webpage, which can be found at https://www.cde.ca.gov/SP/ELCD-COVID-19.asb. And if there are any additional questions, please submit them to the ELCD emergency inbox at elcdemergency@cde.ca.gov. If you have questions regarding this webinar, please contact your assigned ELCD Program Quality Implementation Office Regional Consultant. A list of those consultants can be found at ELCD's Consultant Regional Assignments webpage at https://www.cde.ca.gov/SP/SP/CI/assignments.asb or by phone at 916-322-6233. Next slide, please, Barbara. Okay, I'm going to continue reading these resources while my team decides if there's one more question that we can answer. So what Erica had mentioned before about staff development, that's the California Early Childhood Online, or CECO webpage, and that can be found at https://www.caearlychildhoodonline.org. The Department of Social Services at https://health-and-safety/early-care-and-education-providers #available-training. And those are the health and safety modules through the Department of Social Services. And the last resource is the Office of Head Starts and the Community Care Health and Safety Information. And that website can be found at https://www.cdss.ca.gov/info-resources/community-care/health-and-safety-information. And before we go, I would like to ask Corey to come in just once more and reiterate some information about distance learning that was provided in July and August.
Yeah, so what we have seen, there's a few questions about July and August and not conducting in-person services. So as I said, I think in one of the slides, there was an email that was released on July 19th that allowed both LEAs and non-LEAs to remain closed through September 7th as you were awaiting guidance. from CDE and working through how to best reopen safely. And so in the matrix that we went over for the period between July 1st and September 7th, you will report the days of operation and days of enrollment as if you were open and providing care. So what that is, and you can, whatever expenses you incurred during that time period, you would report as well. So you will be reimbursed based off the lesser of contract MRA or net cost. Again, you still have to report the days of enrollment, but we won't factor that into the calculation of determining your contract reimbursement. But that you will be reimbursed for that based on that those two limits. So
Thank you.
That provided clarification.
Thank you, Corey. It's always exciting when we can get one more question in. So I'd like to ask Steve to come back and close us out.
Great. Thank you, Alana. Thank you, team, and thank you, everybody who's joined us. So on behalf of the team at CDE who are working to give you the best information at a time when information is rapidly and sometimes, unpredictably changing, we thank you for taking the time out of your day to listen to this morning's webinar, and we hope you'll join us for the next one. As I close, I'll just say that, we need all of you so we can keep carrying this labor of love forward. So please take care of yourselves, practice self-care, be safe and be kind, and we'll hopefully see you next week. Bye, everybody.
Bye, everyone.